The profile of the patient that we have at the moment is a young patient between 30 and 50 years old, where the periods of stay in ICU have been longer. This disease knows no age. It is very sad, unfortunately. From one day to another, it can take you away. It is so sad. We are more scared this time. There are many young victims, so to me, this wave looks more dangerous than the last one. Indeed, our feeling is that the patients are younger than they were during the two previous waves a year ago and in October and November.
Welcome to our COVID-19 special. I'm Monica Jones in Berlin, and all of a sudden, I'm also in that age group that's at risk. Remember when we were told to protect the elderly because the virus is especially dangerous for them? And that was right, of course. But it lulled many younger people into a false sense of security. The result, even though older people are mostly vaccinated by now, hospitals continue to work at the limit, like here in Berlin.
We're at the intensive care unit in Berlin's Caritas Hospital. Half of the patients here suffer from COVID-19. Dr. Thomas König and his team have their hands full, and the beds are filling up. Slowly you can see that there is an increase. At the moment, we're not yet in a situation that brings us to the edge of what we can do. But we know that if the numbers continue to rise, we could certainly have problems. In recent weeks, the number of COVID patients in Germany's ICUs has been rising sharply again. By now, the peak of the second wave of the pandemic has almost been reached. Intensive care beds are becoming scarce, and the workload of staff continues to grow. Intensive care nurse Tim Küttler has also noticed that. Now in this third wave, it is particularly noticeable that the patients are getting more seriously ill and they are ill for longer. Also, they need a lot of care. That means the situation is very challenging and very stressful for us. You really need time to relax when you're off work. But it is not just the sheer increase in COVID patients that worries the team. Their patients' health is deteriorating faster in this third wave of the pandemic. They are also on average younger than before, probably also because most people over 80 years old have already been vaccinated. The average age is now much younger compared to the first or second waves. We see that very clearly. We don't really have any patients who are over 80 years old anymore. They are almost non-existent. To what extent German hospital capacities are reached varies greatly from region to region. While some are already completely full, others are still coping. One thing would help: more vaccinations. We won't get out of this without vaccines. They are very important. But it is also important to stick to hygiene measures, keep a distance and observe current COVID restrictions. Each and every one must take this pandemic seriously and can do their part to make us get out of this as quickly as possible. If the number of COVID patients continues to rise, other important treatments would have to be postponed. In some areas in Germany, that is already the case. The situation, many doctors agree, is serious.
The patients are getting more seriously ill, their health deteriorating faster, and they're younger on average than in the first two waves. Let's talk about that now with Ravindra Gupta. He's Professor of Clinical Microbiology at Cambridge University. Good to have you with us. So let's start first of all with the average age. In this report we heard that it's mainly down to the fact that the older generations are vaccinated by now. Is that all there is to it?
Yes, I certainly think that there will be an element of the fact that the elderly have been protected with vaccines. Of course, in the first wave, the elderly were also very vulnerable. So a certain proportion of the most vulnerable may have been infected, may have died. So that leaves a smaller fraction of susceptible elderly individuals. And therefore, that is probably part of the explanation.
But it can't be the whole truth, because we know that this is a phenomenon that we see in many parts of the world, even in parts where the vaccination rate is much higher. So there has to be something else to it.
Yes, but of course, prior immunity is potentially a factor because in previous waves there may have been a disproportionate impact on certain age groups in terms of who was infected, and also what we call a survivor effect. Of course, some people who are infected will have died, and some will have survived. Now, the epidemiology is very difficult to tease apart here because a lot of this is about transmission patterns, circulation of virus within certain age groups, behaviors, of course, because older individuals and certainly people over certain ages and those with conditions have been shielding themselves and so minimizing their social contacts, whereas younger people have been continuing social contacts to a greater extent. So there are many different factors that could translate that could feed into this observation.
And what would explain that those patients that we're talking about are not only younger, but they're also getting more seriously ill? Does this have anything to do with the new variants?
There's nothing conclusive at the moment in terms of the sort of analysis of this, but these are very difficult studies to conduct properly and robustly. So I'm not confident that we will get a good answer to this. There are changes happening in viruses. The variants do have mutations in them. It is possible that they increase virus infectivity and therefore generate more virus particles that may cause greater disease in people who previously would have been less impacted. It may induce different types of antibody or cell responses, which may contribute to damaging inflammation as a result of the infection. There are many possibilities as to why younger individuals are now observed to become getting sick and potentially more sick than they used to.
And of course, I mean, you hinted at it earlier, it also has to do with behavior and the first symptoms of an infection. Very often they can easily be mistaken for a common cold, and younger people, and I'm talking about people who are up to 40 and 50 who go to work, in such an age you don't expect to get that ill. Do you think that they simply wait too long before they get help?
Well, it's possible that certain individuals who are younger feel that they are not going to get worse, and they've been. I mean, this is the problem. Part of the sort of rhetoric or the sort of narrative around COVID-19 was that young people don't get ill and they don't die. That's clearly wrong. We knew that from the first wave, that early last year even, that young people do get ill, they do die. Children can get sick and have severe disease. So there's no absolute. And the other problem is, of course, you need to know what the denominator is. How many people were infected in that age group? And that's really quite difficult to understand because many people don't go for testing. So to actually accurately understand what the percentage of infection is in that age group is extremely difficult.
Finally, what are the implications for both the health sector, because younger people tend to be physically stronger, which means they stay longer in intensive care in order to hopefully get well again, and what does it mean for society? Because we're talking about people who are largely making up the workforce.
Yes, again, I think that we need to remember that the percentage of people who get severe disease across age groups is still very small. So most people who get infected will be fine. You are seeing, of course, increasing cases of severe disease in young people, but that's probably a reflection on the fact that there is a lot of transmission going on in that age group and the fact that they're not vaccinated. So I do believe that extending vaccination to younger age groups is a priority. I think that's clear because, of course, the number of productive years life lost potentially from young people dying is very significant, and these things need to be taken into consideration.
So when we talk about the death toll now, which is still very high, in some countries more than in others, we're talking about younger people dying.
Yes, that's right, and I think that, I mean, it's an important thing to take on board. But we have vaccines. It's a question of access to vaccines and distribution. Also, the timing of different vaccines needs to be addressed, and also the equity of access. So we have interventions, and in areas where there's uncontrolled transmission, we still know that lockdowns work, although they do have very negative effects for the economy. But in some cases, governments are going to have to make the decision as to whether they will institute lockdowns in order to stem the tide of infection and death.
All right, Professor Gupta from Cambridge University, thank you so much.
Thank you. Bye-bye.
Time for your questions now, and it's over to our science correspondent, Derek Williams.
Why should people who've already had COVID-19 also be vaccinated? Aren't they protected?
As your body fights off a pathogen, it forms what's known as an immunological memory of the disease. Various vaccines, on the other hand, deceive the immune system into forming this memory by faking an infection, using a range of different tricks to do it. In fact, some vaccines trick the body so effectively they cause an even more powerful and lasting immunity to a pathogen than a naturally acquired infection does. But several studies, including one from January that's been cited quite a lot, they indicate that naturally acquired immunity in most people who caught COVID-19 appears pretty strong, even months after recovery. So isn't that enough? Well, there's a big if involved. We still don't really know how long immune memory to SARS-CoV-2 will, on average, last. And that goes for both vaccine-induced and disease-induced immunity. Both currently look good for at least 6 months and counting. But based on what we know about other coronaviruses, there's a good chance immune memory will lapse over time, which is why healthcare authorities recommend getting vaccinated even if you've recovered from COVID-19, because it's a safe way to refresh your immune memory and will hopefully lengthen the window of time you'll remain immune. In fact, a few studies have shown that in people who recovered from COVID-19, even a single dose of vaccine often boosts antibody response beyond what the 2-dose vaccine regime causes in people who've never had it. So it should make you even less prone to get the disease again, at least in the short to medium term.
And that's it for today. Thanks for watching. Stay safe.